At the White House, President Trump made the stunning claim that only he has the power to reopen the country, not individual state governors.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be. The authority is total. It's total. And the governors know that. You have a couple of bands of Democrat governors, but they will agree to it. They will agree to it.
The president's remarks come as New York Governor, Democratic Governor Andrew Cuomo teams up with other eastern governors to coordinate the reopening of the region and its economy. The group includes New York, New Jersey, Pennsylvania, Connecticut, Massachusetts, Delaware, and Rhode Island. And the governor of New York, Andrew Cuomo, joins us now from Albany. Governor, good morning.
Good to be with you. Good morning.
So we just heard President Trump say that it's his call when states reopen, but we know, in fact, this falls to governors. So let's talk about what you're doing with this coalition. I know you're not going into it blind, so talk to us, if you could, about the benchmarks that New York State and yourself have to see met before we all go back to work and get on with our lives.
My pleasure. First, as you alluded to, the president's position is just absurd. It's not the law. It's not the Constitution. We don't have a king. We have a president. And entering this reopening phase, if you will, is very, very important. We've never been here before. No one has gone through this. We need a public health strategy and an economic strategy. They have to work together, and we have to take one step at a time. We've said we want to do it as a region because that's how this virus acts, frankly. It doesn't stop at a state border. And to come back from this, we should do it regionally and share information. You know, nobody knows everything here. So work with New Jersey, work with Connecticut, work with Massachusetts, Delaware, Rhode Island. Let's put the best minds around the table, come up with a regional strategy. And as we start to move forward and reopen the economy gradually, have more testing so we can see where we're going, and then watch that meter that measures the number of virus infections spread every day. You tell me the behavior of people today, I will tell you the hospitalization rate in 2 days.
And Governor, I appreciate that this is uncharted territory. That's absolutely correct. And you went over some of the benchmarks there. But from a timing perspective, I'm sure even in your own budget projections, you've got to have an idea of when New York State might be back to something like normal. Talk to us about when this reopening could happen. Do you personally plan on going to a Mets game, for example, this summer? I know you're a fan.
Look, well, first on sports, I would like to start watching sports. You know, whether or not we sit in the stadium with thousands of others, I don't know that that is in the short-term foreseeable future. But I don't know why we can't be watching it on television, right? Why can't you have sports games with no audiences and just to start the sports and the entertainment so people have something to watch and follow? But you're talking months of reentry. You're talking a phased reentry. There is no clear benchmark that you can set. Obviously, everybody wants to do it tomorrow, ASAP. But as you have to calibrate it by watching the spread of the virus. So start opening the valve of people coming back out and economic activity. But while you're opening the valve, watch the numbers every day of the spread of the virus. You've seen countries reopen too aggressively. The virus came back, they had to close again. And we don't want to make that mistake.
Yeah,
right.
Yeah, you're very big on watching the valve. But, Governor, I have to say, when I saw your news conference yesterday with fellow governors, my first thought was, ruh-roh, the White House is not going to like this. Did you give them a heads up that you all were planning that?
We were, governors who were part of it had the conversation with the White House. It's not partisan, Gail. The state of Massachusetts is part of it. That's a Republican governor. This is just common sense. It's just common sense. And it's not.
No, I never thought that it was partisan. I never thought that. But I just thought the White House has made it clear who he believes is a leader. You're saying we don't have a king here. Do you have to work with the White House in terms of how you're going to reopen? Because he seems to believe that you do.
Yeah. Gail, first, this is a total reversal of the president's first position, right? He has total authority to open up the economy. Then why didn't he have authority to close the economy? Why did he leave it to the states and to the governors to close it down? Why did he take the position that, well, it's up to the states to buy medical equipment, et cetera? It's not my responsibility, it's all the states. Now, this is a total 180. All of a sudden, he's in charge of reopening. And by the way, if he wants to do more on the reopening, God bless. I mean, this is a daunting task for anyone. You want to figure out how to do widespread testing, which the federal government should, do it. But it has to be cooperative, and it has to be mutual. And I understand this is a hyper-partisan environment, and the president's running for re-election. I don't care. I'm going to work with the federal government, whoever it is, hand in hand, because that's in the best interest of the people of my state. And nobody can do this alone, because nobody's done it before.
Governor, as we consider the variables necessary to reopen the economy here in New York, I think it's worth looking back at the conditions that led to the closure in the first place. On March 2nd, you were on this program and you urged calm. There was one case at the time and 0 fatalities. By the end of the month, there were 60,000 cases and 1,000 fatalities. But the closure of essential businesses didn't come until the 22nd of March, quite late in the scheme of things. Looking back, do you wish you had closed things down sooner? Do you have regrets, and would that have lowered the death toll?
Yeah, I think it's the exact opposite factually. I don't think you'll find another state that moved faster than New York. Just look at the dates you did. From March 1st to, let's call it March 20th, we went from basically 1 or 2 cases to total closure in like 19 days. Think about that. You closed, I went to total closure in 19 days. Schools closed, businesses closed, only essential workers. Nobody moved that fast. And in that process,
but Governor,
you have to communicate with the people of New York. Go ahead.
Well, I was going to say the question is not whether you move swiftly. Just in your mind, I know this is heavy. This weighs heavily on your conscience. Do you wish, in retrospect, with hindsight being 20/20, that you had closed things down sooner? Former CDC Director Tom Frieden said 80% reduction in fatalities if the closure had come just a week or 2 earlier. So I'm asking you for a bit of reflection.
Yeah. Well, first of all, who knows if he's right or if he's wrong, right? Monday morning quarterbacking is a little premature, especially when the game is still being played. But I think, does everybody, if you could replay the tape, yeah, I want to know where we were in December as a nation. Where were we in January as a nation? Where were we when we saw these cases in China developing? Didn't we think somebody would get on a plane in China and bring it here? That's January, that's February, that's March, that's this nation, that's this White House, that's every state. So yeah, if you could replay the tape, everybody would do it differently. Every public health expert, every editorial board, every media outlet, every government official would do it differently. But no state moved faster than New York, factually.
All right, Governor Cuomo, thank you very much. We look forward to continuing to cover these next moves as the state of New York and the region considers reopening for business. Governor, thank you very much.
Thanks.